It's the weekend. Be good to yourself. It's Katz's Corner with Dr. Aaron Katz and Dr. Philippa Cheetham, where you can get simple, straightforward answers to your questions about health, from diet and supplements to lifestyle changes. To reach Dr. Katz and Dr. Cheetham, call 800-848-WABC. Now, live on 77 WABC, the chairman of urology at Winthrop University Hospital in New York, with co-host Philippa Cheetham, attending in urology at Winthrop University Hospital. Here is Dr. Aaron Katz.
Good morning, everyone. Welcome again to another live round of Katz's Corner here on WABC Radio in New York. I'm your host, Dr. Aaron Katz, and we're live at 1-800-848-WABC, 1-800-848-9222. Give us a call, and we are live in the studio here on this wonderful Sunday afternoon. Glad you could... Sunday morning, whoa. Good morning, Philippa. How are you?
Good morning. How are you?
Now, we are live. It is the morning at 7:03 in the morning. And Philippa, I know you have to leave early. You're going to be on, are you going to be on Fox News today?
Sure. Live at just after 7:45.
Okay. Well, if you want to tune in, Dr. Cheetham has been a regular medical correspondent on Fox News, as well as co-host here on Katz's Corner. How are you, Philippa?
I'm good. You know, one of the advantages of radio is you can roll out of bed, put a pair of jeans on and come straight to the studio. But when you're on TV, you have to get up a bit earlier and get dressed. And
well, they have makeup there for you and people, right?
I know, but you can't really go on TV in your jeans, can you?
Well, you can go in your jeans because you only see you from the top up, right?
Not on Fox and Friends.
No?
They sit you on a stool and you can see everything.
Oh, okay.
Even your shoes. So remember that if they call you to Fox and Friends.
Okay, I will remember that. Well, we started a prostate support group at Winthrop, and if you're interested, you can email us at winthrop.urology@winthrop.org if you're interested in attending. I know, Philippa, you ran the session this week, and that is in collaboration with an organization, a wonderful organization called Male Care. And Male Care has come out now to Winthrop, and we run the support group. I ran it last month, and you did it this month, and it worked out really well, didn't it? I mean, the guys really enjoy coming and hearing you. You gave a brief lecture, I guess, and then it's a question and answer session.
Well, the head of Male Care, Joel Nowak, has been on Katz's Corner before, talking about his journey with prostate cancer, and he has a huge knowledge about prostate cancer, and he actually runs the group, but we were there as guests to give extra information, answer questions, and many of the questions that came up in the session on Wednesday night were the similar questions that we get asked on Katz's Corner, all the confusion about the PSA. Should we have a PSA? Shouldn't we have the PSA? Is the PSA a good test? What are the deficiencies of the test? What are the dangers of doing a biopsy? Does biopsying the prostate spread cancer if you have it? Should you do an MRI first? Should you do a biopsy first? Lots of really, really good questions. And there were a couple of gentlemen in the audience who did not have prostate cancer but had elevated PSAs and had been biopsied that were negative, but there was still this big question mark. So the guys that were in the meeting asked me to talk about it on the show because obviously you've talked there, I've talked there. The next speaker is Dr. Lou Fiella, who's an excellent urologist in Garden City as well. And we want to get more people because the information's there. The more people who can come and get that free information, the better. And we have time there to answer questions. So you can get information through Male Care, MALECARE, and as you said, Winthrop Urology at winthrop.org. And I think it's every month.
It is every month, and it's in Garden City in a beautiful building. Actually, used to be the old Saks building on Franklin Avenue, and they've converted it to a number of offices. Orthopedics is there. Our sleep center is there. And will be the future home of our urology department and the integrative center for holistic urology there as well. But as you said, it's a wonderful venue for men and their spouses, but mainly for men to come and to talk about their issues in a private setting. And not that we can give them a consult. It's really not about yeah, we can advise them a little bit, but we don't have their medical records. We have to be careful, but we can give them a sense of, of what they should do based upon the information that they're providing. So we give a little lecture, and as you mentioned, Lou Fiella will talk about the psychosocial impact of prostate cancer, which is extremely important for both men and their spouses, as men deal with the emotional aspect of getting diagnosed and then having treatment. And
certainly, when I was talking, the support that the men offer the other men in the group is also very, very valuable. A lot of these guys feel very overwhelmed, often isolated when they've had the diagnosis, and it's amazing what you can learn from other people in the group as well.
Yeah, and we talk a lot about the different treatments in these groups. We talk about PSA issues because they come up all the time. And then, you and I, we have this special interest in the alternative methods and diet and nutrition. And with that, we have a phone call from John in New Jersey who has a question about some dietary supplements. Good morning, John. Is John on the phone, guys, in the studio?
Yes, I'm here.
Oh, good morning, John. You're on
Dr.
with
Katz. How are
Dr.
you?
Katz, Dr. Cheetham. How are you?
Good morning. I'm well. Dr. Katz, I am a patient of yours, and I'm on active surveillance. And New Chapter provides a product, Lycopene, which is back ordered, not a stock. I was wondering if you had a substitute product that you could recommend.
We've been recommending a product from Quality of Life Labs up in Purchase, New York, called Lycocell. Lycocell, Lycocell. Yes, John. And I think that is a wonderful substitute for you, and a lot of patients have been telling me that the Lycopalm is not available at this time. So I would go with Lycocell. You can give them a call. They're up in Purchase. I don't know their number offhand, but I think they have a website. It's q-o-l.com. And
well, there's other supplements I take from them as well, I believe.
Oh yeah, then you can give them a call. They also are the makers of the AHCC, which is the medicinal Japanese product, a mushroom product that enhances the immune system, which has been wonderful for men on the active surveillance. How long are you on surveillance now, John? I forget.
I believe it's about 2.5, 3 years.
Oh, great! And how are your numbers doing?
The PSA is great. It's maintaining below 4, and I'm probably due to come in and visit you sometime real soon.
Yeah, and you're happy with the approach that you're taking there? I mean, I'm sure that when you were first diagnosed, maybe you were offered surgery, radiation, some other options as well?
Surgery, yes, and then you recommended the active surveillance, which I decided to stay on, and it's been working out really well. And you mentioned the AHCC. I take that very regularly. And I don't know if it has any effect on any other areas, but I just never seem to catch colds any longer. So I don't know if that has a.
That's the idea, John. I mean, you're absolutely right. I mean, this is especially in this past season. Wow. I mean, the flus and colds have been rampant in this winter session. But AHCC, which enhances your immune system to not only fight cancer but fight colds and other viruses, has been wonderful, right, Philip? I mean, you've seen this as well in your own practice, haven't you?
That's right. I mean, the AHCC is not specific to prostate cancer treatment. It boosts the cells in the immune system, cells called cytokines, macrophages, dendritic cells, all these fancy names. These are the policemen that circulate through the bloodstream, and they should look for cells that are infected, inflamed, damaged, or cancerous. And so it's not surprising that you've noticed a reduction in the number of coughs and colds that you've had on the product. And thank you very much for calling.
Okay, John. Thanks. Thanks again for calling, and also for. It's always nice, when patients call in. I guess that there are biased callers. I mean, callers that call, some people call in because they're doing well. I guess the guys that were on active surveillance that needed to have surgery, and I always tell patients, I don't know what you tell them, but that the surveillance is something that we put patients on and we monitor you, but. Using the nutrition and the holistics, I say generally there's about a 20% chance that they're going to need some treatment eventually, in 10 years. So there's about an 80% chance that you won't need any treatment. I mean, and that's pretty good, and that's much better than some of the other data that I've seen out there for patients that just go on surveillance without using any nutritional or holistic intervention.
I also think there's an important factor here with the whole holistics, because when we see these patients and they start off on an active surveillance program, the holistic program is something that can continue even if they do end up needing surgery or radiation or other treatments down the line, because it can actually keep them in remission once they've had treatment. So I think there's certainly a role for that. Also, the lycopene question that you mentioned, as you know, there's many companies that make lycopene products. It's overwhelming when you go into the health food shops, but one of the great things about the Quality of Life product is that the doses of their ingredients are what has been shown to be evidence-based in human clinical trials.
Absolutely right.
So at least you're getting a good amount of ingredient for your buck.
Well, let's take another phone call. We're having a rather good time here this morning, Philippa. I know you have to leave in a few minutes. I'll miss you. David in Queens has a question about a procedure that we do quite commonly at our center in Winthrop, the green light. David, how are you?
Yeah, well, actually, thank you. I had a green light laser. I actually had the surgery several months ago. It was very successful. And I wanted to know how long after the green light laser surgery should I wait?
Okay. And did we do the surgery for you or not? Or you had?
No, it was somewhere else, but it was very successful.
Okay. Well,
how long before you have to have a PSA should I wait after that?
Okay, that's a good question. In fact, remember, Philippa, we actually reviewed an article in our journal club with the residents last month about green light and not necessarily about PSA, but about maybe missing cancer, because when you do the green light, you're just getting rid of the tissue. You're not sampling it. And people always said, well, you know, are we going to miss cancer? But in fact, we don't. The PSA, I don't know what you think, Philippa. I usually tell guys to wait about 6 weeks. What about you?
I agree. I mean, it's not just the laser procedure itself. It's the cystoscopy. It's the presence of a catheter in those that have a catheter. So all of these factors can increase the PSA. And there's no rush. If you've had a green light, there's no rush to do the PSA afterwards. You know? Yeah,
it's a good point. I mean, I did a green light on Thursday this week, Valentine's Day, but it worked out rather well. And
for you, anyway. I'm not sure whether the patient feels the same.
No, he wanted to do it on Valentine's Day, and I was home. It takes me about 40 minutes or so, you know, and then I got home in a good amount of time. Left him with a catheter overnight, and I was going to leave him for the weekend, but he was just doing so well. There was no bleeding, and took it out Friday morning, and he was very, very happy. I think for the right patient, and David, you probably were the right patient to have it. You did rather well with it, right?
Yes, it was excellent. And could I have one other question about finasteride?
Finasteride, sure.
Okay, can you take DIM along with if you have taking finasteride?
Can you do what?
Can you take the supplement DIM if you're taking finasteride?
Can you take DIM? Okay, thanks for that question, David. So DIM, which is a supplement that has a lot of cruciferous vegetables in it, broccoli, kale, cauliflower, and condensed into a pill form, can definitely be taken with finasteride. Now, David, if you already had the green light, I don't know why you'd be taking finasteride, which is a medication to shrink your prostate. If I take the guys off these medications, you know, Philippa, I mean, I think that's the nice thing about the green light. Once you have it done, you go off the medications.
Agreed.
Yeah. You have to go?
I'm going to run away and leave you now.
All right. Have a great show, Philippa.
Okay, so if you've got calls, call in 1-800-848-9222. Keep Dr. Katz company, please. 1-800-848-9222. You've got him all to yourself for his prostate questions.
All right. Thanks, Philippa. Have a great show. Good morning, everyone. It's 7:15 in the morning. If you're just waking up, it's Katz's Corner. And as Philippa mentioned, if you have a question, I am here for just about another 15 minutes at 1-800-848-WABC. If you just missed, we mentioned that we are running our prostate cancer support group in combination and in collaboration with Male Care. And you can email us if you have some questions at winthrop.urology@winthrop.org. I also want to remind everyone that this coming June, not that far away, I know it seems like it's going to be ages before it warms up around here, especially it's going to be another snowstorm. But Saturday, June 15th, save the date, Saturday, June 15th, Garden City Hotel, the Men's Health Seminar. And if you are a physician, a primary care doctor, March 19th, we are running the first ever urology for the primary care doctor. I mean, this is so important for doctors, primary care doctors, when men and women come to their office and say, I have problems urinating, or men say they're not having the sexual drive. We have lectures about that, about testosterone replacement, about how to evaluate men with PSA issues, prostate cancer. We've got a whole day of wonderful lectures for the primary care doc. So if you're interested, it's for doctors, but if you're a primary care doc, or you want to say, hey, doc, I was listening to Dr. Katz on the radio, and, they're running a great seminar March 19th, just a few weeks away. Again, you can reach us again at Winthrop Urology at winthrop.org, and we can help your doctor and educate the physicians about both the conventional and the integrative ways that we use every day at our center in Garden City, as well as on Park Avenue. Good morning, Bill from Blue Point, New York. How are you?
Good morning, Dr. Katz.
How are we doing?
Okay. I just have a quick question. I go to the VA, and my PSA has been 4.67 down to 2.9, 3.1. In a matter of, a couple, 3 weeks, a month, we redo the blood test. I had a first-time free PSA was 14.7. And they felt a slight hardness or little bead on the right-hand side of the prostate. When does one know that you should get a biopsy, because there's so much controversy about infections and whatever?
Yeah, it's a good point. There is no, well, sometimes there's an absolute, Bill. I mean, if I see a guy with a PSA of 20, to me that's an absolute. How old are you, Bill?
70 and a half.
70 and a half. You have a family history of prostate cancer?
No, but there is cancer in the family.
But not prostate, though.
No.
Bill, for
Not
you,
that I know of.
I would do a couple of things. I would do an ultrasound and see how big your prostate is, because, for your age, you're not giving me a number that's alarming, a PSA of around 4 or 2, or, it's fluctuating. So I'd like to know your size, and then I would like to calculate your density. There's also another urine test that I do in my practice. A lot of doctors are now picking up on it. It's called a PCA3 test, the PCA3 urine test, which is the gene test for prostate cancer. To me, I would get that on you, because you're someone that's kind of on the fence. I would also want to do my own digital exam to see if you have a real nodule there, do an ultrasound, and then perhaps also get an MRI of your prostate to see whether or not there are any suspicious areas that should be biopsied. The infection, yeah, it's real, but if you take the antibiotics, if you get a urine test, make sure you don't have an infection first, and you get the antibiotics before and then a few days after the biopsy, the incidence of a bad infection, it's probably less than 1% at this point. Okay?
That was my problem. I was in the hospital in Stony Brook for 5 days with intravenous IVs for an infected finger. When I came out, I had, they said you might have loose stools, which I've had since November, and it's not that loose, but I tried to give a sample, and they say it was too firm, and they can't decide whether I have C. diff or not. And my urologist says, if you have that, you can't do a biopsy.
Well, you don't want to do a biopsy with C. difficile. That is correct. But, C. diff, you probably would have more fever, probably abdominal pains, things like that.
I don't have that.
Well, those are the things I would do, Bill. I don't know if they offer that at the VA out there, but, the PCA3 test, an ultrasound of your prostate, or maybe an MRI.
I had tuner also about 4 years ago because of frequent urination. It didn't do a thing for me, but does that interfere with any procedures?
No, it wouldn't. No, it wouldn't interfere with anything,
Not with
Bill.
cryo either?
No, sir. No, but let's see. You need to have a diagnosis first before we talk about treatment.
I want to come and see you. Anyway, how do you know what doctor to see when you have this kind of a diagnosis, or if you do have cancer, you just don't go to a general urologist, right?
Well, no, that's not true, actually. I mean, general urologists are, we deal with prostate cancer a lot. 1 in 6 men have it. So, you could also get an opinion from someone that just deals with prostate cancer. My practice is majority prostate cancer. You could see a medical oncologist if you wanted another opinion from someone to kind of guide you, or if you had advanced prostate cancer, a lot of people see medical oncologists as well.
Not a uro-oncologist?
A urological oncologist, yeah. But you first need to have a biopsy. Well, you have to see if you need a biopsy. And, if you want to come see me out in Garden City, I know you're in Blue Point, then make an appointment, Bill. I'll be glad to see you. And that's at Winthrop Urology at winthrop.org, or you can give us a call. It's 516-535-1900. Let's go to Tom. You've been waiting on the phone. Good morning, Tom.
Hi there. I wonder if you recommend any natural supplements for erectile dysfunction instead of the Viagra or the Cialis or something like that.
You know, Tom, for the most part, they really don't work. There is some data looking at arginine to enhance blood flow. If it's a blood flow issue, if it's a cholesterol issue. I mean, have you checked your cholesterol?
No.
How old are you?
66.
66. It also depends about, if the erections are not there at all, or if you just need a little help.
Probably the latter, a little help.
Little help. I mean, arginine can help, but for the most part, the supplements that you hear on the radio, you might want to check your testosterone level. There's a lot of data now indicating that low testosterone levels may, interfere with the quality of erections. I don't know if you've had the testosterone checked.
No.
I would probably do that. I would check your cholesterol. Are you overweight?
No.
Okay. Are you doing aerobic exercise?
Yes.
Good. And you're eating healthy?
Right. And it's sort of just started, and it's not every time.
Right. Well, the other thing is stress. I don't know if you're undergoing any stress, or that can have a major impact on your sexual function as well. Medications for high blood pressure, diabetes, those can all affect it as well. But your question to me was, are there any herbal supplements that
work
help?
As well as the chemicals?
I haven't found that to be the case. I haven't. At this point, and I think, you should speak to a urologist. And, the low-dose Cialis nowadays, the 5 milligrams, seems to work quite well to help urinary function in terms of, urinating as well as sexual function. It's well-tolerated, low dose. You take it every day. It gives you less, you have a little bit more spontaneity than the Viagra, which is a 4-hour window, or the Cialis, which is, the Cialis, the 20 milligram Cialis, I like for my guys too, because I tell them it's the weekender. You take the pill on Friday and you're good for the weekend. So it gives you a little bit more spontaneous than the Viagra.
And usually, in spite of the ads, usually most of those side effects don't happen to most healthy men. Well,
the prolonged erection lasting more than 4 hours, that's not going to happen unless you're going to go to the injection therapy, and there it can happen. We'll have a show on in a couple of weeks. We're going to have one of our experts in the area, Dr. Brett Mellinger. He'll be on talking about all these different treatments. And you can call and ask him about the herbal supplements. But my own experience, with patients, and they come in and they try different things, or things on the radio. We had a girl here from a company called Hot Rocks. Some guys seem to say that helps them. You can go onto hotrocks.com. You can try it. It's an herbal supplement with no side effects, and I don't know, some guys seem to have a benefit from it, but overall, the medications are probably worthwhile.
Okay, great. I enjoy your show.
Oh, thanks, Tom. Thanks for tuning in. I appreciate that. Let's go to Shaw in Brooklyn. Good morning. How are you, sir?
Yes, sir. Fine. I'd like to elaborate on an article in February 13th from the New York Times about the pros and cons of hormone therapy.
Yeah, that article, thanks. I should have talked about that article in the beginning, and I don't have it in front of me. But the gist of the article, sir, was that a lot of patients that get radiation therapy are getting a lot of hormones with radiation therapy. And the recent study that was just published, and again, I don't have all the facts and figures, but I know the study, was the bottom line was that more hormones is not necessarily better. We used to think that, 3 years of hormone therapy with radiation is going to improve survival. But the shortened course of hormone therapy, and I usually use it at most 7 months. I don't like using hormone therapy, even in my guys with advanced prostate cancer. I am a firm believer in intermittent therapy and reducing the amount of hormones, because it will reduce the side effects, reduce bone loss. You'll improve your erections, your libido, cognitive thinking, heart function, all these things. There's so many side effects with the hormones. So I'm more of a minimalist and believe less is more, and that's what this study basically showed, Shaw.
Correct. Thank you for elaborating, and I would like to just add this, that when I attend your seminars, there's not enough black men, and we are proportionally high in PSA and prostate cancers would attend your seminar. Would you announce again when you're going to have it?
Yes, and listen, Shaw, I appreciate that. It's going to be on Saturday, June 15th, and you're absolutely right that African-American men, they don't attend the seminar enough. And I rely on you and your friends and anyone that you know to get into the churches and get out the word that they should attend this seminar, because you're absolutely right. African-American men are diagnosed earlier with a more aggressive prostate cancer. They need to be screened. So listen, help your brothers out and spread the word. It'll be on June 15th at the Garden City Hotel, and we're going to get a website up and running in a few weeks where everyone can sign up. And thank you, Shaw, for your comments.
Thank you for your great work.
Thank you. Okay, I think we have time for maybe one or two more phone calls. Well, we have a woman on the phone, Linda from New Hyde Park. Good morning.
Good morning. Thank you. I was wondering, you recommend testosterone for men. If a woman has a very low, doctor said that for some reason it was tested, just a general test at one time. If it's very low testosterone, would you recommend a woman treating for that, or just leave it alone?
No, I've never heard of anybody. You mean a woman with a low testosterone?
Yeah, I do. I have very low testosterone.
Well, you're a woman. You have ovaries. You're going to make estrogen.
No, but she said it was very, extremely low.
Sound like a woman to me.
Well,
I don't know. I would not tell you to take testosterone. I'm sorry, Linda.
So is it all right? Is there a reason why you'd have very low...
yeah, because you have ovaries, okay? And you're making estrogen.
The ovaries were removed.
Uh-huh.
Would that be? It would be just the opposite. Wouldn't it be estrogen?
Yeah, your estrogen levels might be low, and if your estrogen is low, then perhaps your testosterone is low. But no, I would not tell you to get testosterone. But maybe speak with an endocrinologist. That's
I would listen to you. I would just not do anything. I let it go. It's been a few years, and I was thinking about it.
Right.
I had breast cancer now it's 13 years ago. So that's been fine. That's been all right. And this is just...
And are you on estrogen replacement?
I'm not on anything. I've never... nothing. I haven't done anything. I had a lumpectomy and radiation, chemo, and everything was fine.
Yeah. Well, I don't know. I'm not an endocrinologist and don't profess to be. I don't think it's odd. I think
really?
It's. I don't think that we routinely obtain testosterone levels in women for that reason.
Right. I was so surprised. All of a sudden, this I don't see her now. It's a woman doctor, and she said, "Oh, your testosterone is very low." She made a big thing about it. It's really low. So I don't know what's wrong with me.
I don't think there's anything wrong with you. I don't think there's anything wrong, but maybe you should seek the advice of an endocrinologist. But
no, I'm going to let it go. I appreciate it. I just want to know. Would it cause cancer if you did treat it?
In your particular case, I'd be concerned about giving more hormone therapy to you, whether it be estrogen or testosterone. Thanks, Linda. Well, that was a quick half hour. Dr. Cheetz is gone, and now it's time for me to leave. Very quick half hour. I hope that you all enjoyed the show today. I enjoyed being with you and helping you, our friends and colleagues out there, get through the information. Sometimes it's difficult and confusing. But tune in every week. Tune in every Sunday here at 7 o'clock. This is Dr. Aaron Katz.